At MedsPLUS Consulting Pharmacy and Wellness Center, you're not just a number. We offer individualized care for each of our patients, plus prescription delivery and medication management.
MedsPLUS is there for any and everyone who wants a special touch with their pharmacy needs.
Call or visit today for a free consultation.
Bringing the pharmacists back to the community, MedsPLUS Consulting Pharmacy and Wellness Center.
Visit MedsPLUS Consulting Pharmacy and Wellness Center in downtown Birmingham at the new South Federal Building.
Hello, everyone. Happy Monday. It is time for MedsPLUS Medical Minute Live. I'm Dr. Jennifer.
I'm Dr. Pauline.
And we want to welcome you today. And if you follow us on social media, you probably saw where we were going to talk about how this month is Diabetes Awareness Month, the month of November. So in talking about diabetes awareness, as well of other chronic conditions, we would be remiss not to talk about what is on the hearts and minds of all Americans, particularly here in our city, Birmingham. So we wanted to talk about how SNAP benefits were not being reloaded to the EBT cards. And that means families who rely on these benefits are facing an uncertainty about how they will put food on the table. We had a national broadcast here today. The mayor spoke with the personality there. And as quick as that, Birminghamians have come together. We've seen on social media pages, many food distribution sites, including churches and other organizations. So we want to make sure that we're speaking top of mind of what's relevant and what's happening now. So just a few talking points I want to bring up about SNAP, which stands for Supplemental Nutrition Assistance Program. It supports over 40 million Americans, especially our children and seniors. When those benefits are delayed, it's not just a financial issue, but it also becomes a health issue. Missed meals can lead to low blood sugar, poor nutrition, and medication complication, especially for people managing chronic diseases. As I said before, our local food banks and nonprofits here in Birmingham are already mobilizing, and the need is overwhelming. As pharmacists, we see how access to food directly affects how people manage their health, and we want to be able to talk about that connection and share some useful tips.
That's absolutely right, Jennifer. So we know that when people can't access healthy foods, it's not just a hunger issue, it is a health issue. And being able to access healthy foods is vital for people, suffering with chronic diseases such as hypertension, heart disease, diabetes, and others. People with these conditions rely on consistent nutrition to manage their conditions. Food insecurities can cause fluctuations in their glucose, especially if they have diabetes, can cause fluctuations in their blood pressure and medication adherence. I remember being a pharmacy student over 20 years ago, and this was actually before the Medicare Part D or the drug plan for Medicare. And I vividly remember people coming in asking for $5 and $10 worth of their medication because they were deciding on purchasing their medications or purchasing food. And unfortunately, even with benefits such as Medicare and Medicaid, we are back at that scenario where people are having to decide whether I'm going to feed my family or purchase their medications. And we know that stress, not only from the daily stress that we have, but from a financial strain, can elevate cortisol, which is also a risk for metabolic conditions like diabetes and heart disease. Poor access to healthy foods can contribute to higher rates of obesity, depression, and hospital readmissions. So this isn't about an individual choice. It's about structural barriers and economic inequities that we must acknowledge and address. What can we do about it? especially with so many people feeling anxious and uncertain right now. This is where healthy coping comes in.
Yes. So, one of the things that we want to share is a topic that we discuss at length in our diabetes education class, and that is healthy coping. It's one of the most important lessons I feel that we teach because a lot of people may not know or understand the correlation of stress, anxiety, and just managing a chronic condition, what that can do to your health. So, healthy coping means having a positive attitude towards your diabetes, pre-diabetes management, or any other type of chronic condition while maintaining supportive relationships. Not all coping skills are healthy. If we isolate meals or skip meals, that can make things worse. So, the American Psychological Association defines resilience as successfully adapting to difficult or challenging life experiences. Resilience is our ability to bounce back. Some people are born with it, some people have to develop it, but it can be built. So, what are some ways to strengthen resilience? One way is to talk with someone. Don't be silent. This is not the time to be private, but share what you're feeling with someone trusted, whether it's a therapist, a pastor, or a really close friend that you trust. Focus on self efficacy or self sustaining behaviors that can add up to increase your well being or improve your well being. Practice optimism or celebrate your small wins. Lean on community. Support reduces stress and it builds support and it builds strength. As we can see many people coming together over the coming days and months, I hope that we're reminded of what we as a people or community have had to go through in the past, and how when we come together, we are much stronger and we're able to fight anything. We want to make sure that we remember these small principles that we know that are embedded in us deep down, and we want to be able to share these concepts and making sure that we're living those out. And also, as a tenet of MedsPLUS Consulting, Dr. Pauline and I believe in these strongly, and this is why we are stepping up for our community.
Absolutely. So at MedsPLUS Pharmacy and Wellness Center, we know that health decisions don't happen in a bubble. They don't happen in silos. In fact, we know that out of 100% of your healthcare services, only about 20% are actually related to medical care. The other 80% are what we call social determinants of health. And food access is one of those huge determinants that lets us know how well you can adapt and be resilient to changing times. So if you're ever forced, if you or anyone you know are ever forced between having the decision to buy food or buy medicine, please reach out to us. Please, during these times, don't go without your medications, because we know that not taking your medications, not being adherent to your medication regimen can cause you to be admitted to the hospital, can cause undue complications regarding your health conditions. For instance, if you have diabetes and you can't afford to get your GLP-1 injection or your metformin or your insulin, it can be a barrier to you maintaining good health. So what are we doing here at MedsPLUS during this time of economic uncertainty and people not receiving their food benefits? The first thing that we're doing is we're making arrangements with our patients, and you can be our patient, to make arrangements to fill your prescriptions without you necessarily paying for them at this current time. So that's one way that you can focus more of your money to making sure that you're able to feed your families. The second thing that we're doing, and we've always had this service, is delivery of your medications. So some people are having to pay for food, so they may not be able to pay for gas to actually get to the pharmacy to get their prescriptions. Well, MedsPLUS Pharmacy and Wellness Center can actually deliver your prescriptions to your door or to your office. Our main thing, and this is our logo or our motto for our business, is bridging the gap in healthcare. So we stand in the gap by offering care, education, and compassion when it's needed most. Jennifer talked about the healthy coping that we have during our diabetes education class. And I just want to let you all know that this is a free class that we're offering in the community. Right now, we're in the community of Fairfield, and we're offering this service free of charge. And during this time for people with diabetes, we talk about healthy coping as one of the strategies to dealing with diabetes. But we also talk about healthy eating. We talk about behaviors and lifestyle changes that you can do to help manage your diabetes. Our community health workers are hard at work right now compiling resources that you can use to get access to food and other services that you may need to deal with managing diabetes during this difficult time. So we want to let you know that if you're interested in joining our class, it's not too late. You can call our office at 205-650-4636 and be signed up for the class that is actually happening this week. We also want to let you know about a podcast that Dr. Jennifer and I will be doing this week, Speaking with Sandra L. And at this time, we'll be recording it on Wednesday, but we're not sure whether it's going to air live or whether it's going to air at a later date. But stay tuned to our Facebook page and our Instagram page, and we'll be sure to let you know when and where you can check out this podcast.
Yes, we're super excited and honored to be invited to her platform. Another thing I just want to bring up is, it's the month of November. The weather's changing. So we know we're getting ready for holidays. So we got Thanksgiving coming in, then Christmas. This is a time when a lot of people are stressful. A lot of people are lonely, alone, or missing loved ones. But we just want to make sure you don't have to face it alone. Make sure that you're part of a group or support system that you may have formed, and continue to reach out with other people as well. So let's take care of ourselves and each other so we remain healthy and whole for those who depend on us. From MedsPLUS Consulting, Pharmacy and Wellness Center, we are happy to be here for you, where your health and wellness is our main priority.
See y'all next week. Bye, everybody.
Bye.
At MedsPLUS Consulting Pharmacy and Wellness Center, results matter. Don't settle for less when it comes to your health. Empower your health journey with a pharmacy that puts you first. Transferring your pharmacy is easy with our guidance. Plus, we offer prescription delivery and medication management.
Bringing the pharmacists back to the community. MedsPLUS Consulting Pharmacy and Wellness Center.
Visit MedsPLUS Consulting Pharmacy and Wellness Center in downtown Birmingham at the new South Federal Building.